and being a project leader for the Temple University Public Health Beyond Borders Dominican Republic project.
Okay, thank you so much. And just before we start, attendees, if you have any questions, um, please send them in the chat, and then at the end we can go over it, or like you can ask her yourself. So our first topic, like education and career path. So question one, what exp inspired you to pursue public health and specialize in epidemiology?
Yeah, so what at first initially inspired me to pursue public health is when I did community work in the Dominican Republic when I was 15. So this was done on a school-based project set up by one of my teachers in high school, and his goal was to ethically help people and do it in a way with lots of community involvement. And to be honest, this is where I first learned what I consider to be the most important part of public health, which is that by working directly with communities and local leaders, you can develop a more in-depth needs assessment and plan that is better based off of the community and which exact community needs are needed to benefit the population. And then I chose to specialize in epidemiology when I was working at a COVID-19 testing and vaccination clinic because I was doing a lot of work with data and found out that I really like to work with numbers and statistics behind things. And I got to see in real time every day our positives, negatives, those types of numbers. And that really sparked my interest and was kind of how I got into epidemiology.
Thank you for that thoughtful answer. And moving on to question two, how do you envision like your career path evolving after you complete your MPH?
Yeah, so first off, I just want to say I am still very young and I don't have everything in my life exactly planned or figured out. And it's okay to be uncertain about things like that, especially when we're so young. And I have my whole life to do different positions and companies um, in public health. But I think my first main goal that I'm going to do directly out of college or out of my master's program is to look for a more permanent full-time role, hopefully involved in health education. And I would like to ideally be in a role where I could use my epidemiology background to analyze the health education data, which would be using like pre and post tests to see which methods of education work best. But another thing I'd like to do is also do disease surveillance at a higher level than what I'm currently doing. Again, I just like data and like looking at the numbers, so I think that could be something I was really interested in.
Yeah, that's really important, especially like just like ha having something solid to do after college.
Yes.
Now, moving on, something just as a student, what skills have been critical, like the most critical for your success as like a public health student?
Yeah, of course. As a public health student, I found my most used skill that was the most helpful was just kind of be social and interested in other people, which I know sounds a little weird, but this just means like putting yourself out there. In college, you'll get a lot of opportunities to go to like research days, career fairs, stuff like that. I highly recommend going to these events, even asking your professors questions in class, but you could also meet with professors after class and just kind of talk about their own research because many professors do research outside of teaching. So just kind of asking them about that. Um, People love to talk about their work and what they do. So I always found it was super easy. And if you're also a public health student, or if they do have a similar field you're interested in, it would be a really good connection for possible job opportunities in the future. I also do this, I try to work public health into a lot of conversations I have. I've done this with at part-time jobs over the years. I used to be a barista and I knew the public health companies in my area, and honestly, if I saw regulars wearing merch from that company, I would try to talk to them about public health and just kind of get my name out there. Through this, I found some job opportunities, volunteer work, but even if you don't find anything, you also are just having a good conversation. Um, but another skill that's a more technical skill is I would definitely work on coding skills. If you're familiar with SAS or R, I found that to be super helpful and needed as like a technical skill in the field that what I didn't necessarily know I needed a ton before getting into the field.
Yeah, that's definitely important, especially just putting yourself out there so people like know about yourself. And moving on, like more specifically about your research, um, how did you like balance like the technical and like community engagement aspects of your research?
Yeah, so I'll be honest, and so far I've not had a position where I was doing technical work and community work at the same time. So a lot of my community work was done. Um, we didn't really use a lot of programming for it or any statistical software, but um, I would say it's definitely really important to do community research in every type of research problem you're kind of looking in. And um, to kind of add, I'm working on a project now, and I thought about ways that we could try to include more community aspects into our project. And so for that, I would say kind of having like a referral program or something um, to join our project would be a good community engagement, or kind of just to have um, just like events going on in the community to help with that.
That's really important, yeah. And moving on, like just what are some like surprising or like challenging moments while like while you're researching?
Yeah, so one challenge I did not anticipate was how long the research process actually took. I learned a lot about it working on my fieldwork this past year. I did not realize how long data cleaning would take, and there's coding was like a completely different language that you have to learn. So, I would say that was definitely a challenge for me at first. Getting used to using R and SAS was hard, but I had to take a few courses in my undergrad degree and in my graduate program. So I would say that I utilized those courses a lot. They really helped me out. Um, and then another challenge I faced was kind of sometimes you would, or we would develop plans for our educational materials, and last minute we would be thrown into a situation we were not prepared for. So that was a little bit challenging. We were prepared for small group settings and then had to transform our small group talks into a large auditorium-sized presentation. So we kind of had to figure out which parts of our lesson we were going to leave in, which parts to change. And luckily, we did have some backup material prepared just in case we did need more material. So, yeah.
That's true. But research just like it's like a really long process in general.
Yeah.
And then like how has like working in disease surveillance like helped like to shape your understanding of public health threats and like responses?
Yeah, so I would say one thing working in disease surveillance has taught me is that every person in population is not, or every person inside of a population is not the same, and that not every disease affects every single person the same way. So in my research study, we um, have a long survey and kind of go through every case of COVID-19 that someone has and find out about their symptoms and such. So it's been really interesting to kind of see how this disease has affected certain people at a worse way than other people. Um, and it also really helped me learn that there is not one solution that will work for every single person. And even though we can generalize a lot of recommendations for things or generalize medications and such, there will still be people within a population that might not be able to have that generalized like precaution or medication or something or vaccination, anything. So there just will always be more than one solution to a problem.
Thank you for that thoughtful answer. And then moving on for your work experience, like how did you like contribute to the Lead and Healthy Homes project and like what outcomes like were you personally most proud of?
Yeah, so the Lead in Healthy Homes project was my senior year internship project. It was our legacy project, and I was able to conduct research with the Philadelphia Department of Public Health on the Lead in Healthy Homes project. And so I was able to do a ton of research on lead exposure and how lead gets into water or just into our homes in general. And then with this research, I also compared what different cities, so cities that are similar in size and such, which my supervisor said were Chicago and Seattle. So I familiarized myself with what these um, projects were doing in their cities and kind of compared it to Philadelphia and helped update all of their educational materials so that they would have better materials that were also easier for people to understand about the dangers of lead poisoning. And I was also able to help contribute some new ideas to bigger projects, but I didn't exactly help on those. But I was most proud of just seeing work that I have done used in a setting outside of an academic setting. It was just very kind of surreal to see my work actually being used.
But yeah, that's really interesting about like lead and like what it does. And I think I messed the slides up, but this should be the last question. Like how has working on diverse projects like local clinics to like international like initiatives like influenced your perspective on public health?
Yeah, so I've worked on many different levels and different ways in the public health system. But, and all of it has honestly taught me so much. I've learned something new at every job I've had, and I'm so lucky to have that opportunity. Um, but it honestly has strengthened my opinion that a good needs assessment is the key to a lot of solutions in public health. And it has also shown me that public health is a concern in all areas of life. It does not matter where you are, what you do, who you are, who you know. Like public health will always affect your life in the simplest and most complex ways. Um, One of the biggest public health initiatives is simply washing your hands. And I just think I've really learned that it truly is in every aspect of your life.
That's really interesting about like just how everything like all connects together. And that's the last question that I made. And we're just move on to live Q&A. If anyone wants to send any questions in the chat or like if you want like unmute and you can ask Julia herself any questions you have, and we'll give a few minutes for that. You have a question in the chat. How did you balance work as a student and like other projects slash research?
Yeah, so honestly, the best thing for me was having a schedule in college, especially just because you're kind of on your own in a new routine. So definitely setting aside set times where I would do my schoolwork. Um, and then I would also have set times where I would do my research. And luckily, my research job does let me do some of my schoolwork while I'm at my work, so I can also balance that way. But I would say definitely just setting like a schedule and realistic goals. I'm a big advocate for realistic goals because you want to make goals that you can easily reach. So I would always just set goals for the week and a schedule for myself to kind of balance everything.
Okay, that's really interesting. And I'm not sure if there's any other questions, but like this is a question I have of my own actually. And it's like I know you kind of did something like related to like COVID-19, I think it was. And it's just like what lessons did you learn from like working in like those clinics, and like how do you think that like relates to like the future, I guess, in a sense?
Yes. Yeah. Yeah, so I did a lot of work with COVID-19. I started working as a volunteer for a local pharmacy, and that's kind of how I got into the role. They ended up hiring me to be a part of their task force. And I would just say, like learning things for the future, I feel like a lot of things that we talked about during COVID, which would be kind of like having better hand hygiene, but also staying home with your when you're sick. I think that that really got enforced during COVID-19 and started helping people make healthier decisions in that way. But I feel like now we've also seen somewhat of what a modern pandemic looks like, so that if we are faced with something like this again, I think we will be better prepared and have a better idea as to how we should handle that situation. Whereas when COVID-19 happened, we hadn't seen something like that before, at least in modern times. So yeah.
Okay, thank you for that answer. And does anyone else have any questions for our speaker? I don't think there's any more questions, so just I guess moving on. We posted like we published our first edition of our magazine on our website, and like if you want you can check that out, and we're gonna send the link to our website in the chat in a bit. And then these are our socials, our website, our Instagram, and then our email. And if you want to work with Scienceholic as an or like you can work with us as like a team member, like part of our team, like content editing, art, outreach as I am, social media, AP Toolbox, or just like an ambassador. Or if you want, you like submit like blogs or magazines to be featured in our magazine, like the one I was previously talking about. Or if you just want, you can like join our mailing list with the email that should be sent in the chat in a bit. And then thank you to our partners like Healthy Mind, Healthy Lives, and like Teens and Health for helping with this year's conference and everything. And then thank you so much for joining us today, everyone. And special thanks to Julia for taking time out of your day today just to come talk with us. And if you would like, feel free to join our next session, which would be tomorrow at from 6:15 to 7:15 p.m. EST for Embodied Eating, Embodied Living with Mallory Page. And you guys are all free to go. Thank you so much for coming.